In this lesson, we're going to do some more practice problems for med-math calculations for injectable medications. Let's just look at a few key points. So one thing you want to always look at with these is the units. What is the problem actually asking for? Are we looking for milliliters? Are we looking for the actual dose, like micrograms? Make sure you know what you're looking for. Some medications that might be used for injectables would be like IMs, sub-Q injections, intradermals, IV pushes, etc. So these are things that have a volume but may not have a time or a rate. As with any other problem, you always want to look at appropriateness. For example, did you get a result of giving 10 milliliters in an IM injection? That is not appropriate. We're talking about typically 2 or less, maybe 3 or less, but 10, definitely not appropriate. You should reevaluate, see if you missed anything. And then again, same with orals. You're typically looking at a per dose type of formula because you're not looking at a rate or a time. Okay, so let's work some of these out. First one, the order is 7,000 units of heparin sub-Q every 8 hours, and heparin available is 5,000 units per milliliter. How many milliliters should you administer? Now in these, I'm going to strictly use dimensional analysis because it's my preferred method. If you want more on how to use the formula method, check out the oral medications lesson or the basics of med calculations lesson. So the first question is, what are we looking for? How many milliliters? So I'm looking for the number of milliliters per dose. So always start with what you're looking for. Transfer your top units over milliliters. Insert what you know. Do I know anything? Am I given anything about milliliters? Yes, I am. I know that 1 milliliter is 5,000 units. Okay, transfer my units up. What else do I know about units? Well, I know that I want 7,000 units in 1 dose. Okay, cancel units. And am I left with what I want? Mils per dose? Yes, I am. Multiply across the top, divide across the bottom. You end up with 7,000 divided by 5,000, which gets us 1.4 milliliters per dose. The last step is always to verify. Does it make sense to give about 1.4 milliliters or to give 1.4 milliliters specifically in a sub-Q injection? Well, it's a little bit high, but it's not too high. It's appropriate. Let's look at the next one. Haloperidol, 2 milligrams intramuscularly 1 time. Available haloperidol, 5 milligrams per milliliter. How many milliliters should you administer? Again, start with what you're looking for, milliliters per dose. Transfer your top units across, milliliters. What do I know about milliliters? I know that 1 milliliter is 5 milligrams. Okay, transfer units again. What do I know? Well, I already used this one. So the other thing I know about milliliters is that I want 2 milligrams per 1 dose. Cancel milligrams. I'm left with milliliters per dose, which is exactly what I want. Multiply across the top, divide across the bottom. 1 times 2 divided by 5 divided by 1 is going to give you 0.4 milliliters per dose. Does 0.4 milliliters make sense for an IM injection? Does it make sense for this calculation? Yes, it does. We have verified.